But this is a case, this is one of the two last cases of this webinar. This one, I started this case in my Teethan era. Okay, I started with Teethan, and it's not finished at all now. I'm finishing in these days. Okay, but look at that. Okay, this is the first visit. We had our digital impressions. And look, okay, on the upper and right side, no teeth at all. Of course, everything in this moment is absolutely unbalanced. Okay, you can imagine that. We started this case with lab side virtual workshop. Okay, these are a few images from my technician. He works on Exocad, and this is a workshop printed. Okay, this is a try-in printed with a resin, standard resin. There is also X-ray resin. Okay, you can use it like a X-ray guide and X-ray stand. Okay, this is the try-in of this workshop, and these are the real contact points with my contact paper, and I scanned in color and through color the contact points with a classical paper, okay, analogical way. And this is the Teethan examination. And like I said before, this is the most important time when you have to check, because if you have a wrong balance, a wrong digital dimension in this moment, at this moment, probably you will have also later. Okay, it's absolutely obvious. Or maybe you are very lucky, but I don't trust in luck. Okay, this is sorry, this is the rebalance, not perfect, but almost perfect. Okay, and after that we undergo the Cbct examination, the project, everything in digital, and everything to the lab, 100% digital. And the lab side, we absolutely, with our with my technician, we maintain all the occlusal values that I managed in intraoral side with the try-in and with the Teethan. Okay, the aim to me is to maintain the height, the vertical dimension, the balance, the contact points. Okay, I want to maintain, and the digital is absolutely the right way to maintain 100% of information. These are this is the how we work today. Virtual extractions before surgery, virtual abutments. These are multi-unit abutments, and virtual workshop of the provisionals. Okay, we print the provisional, of course the outer side of the provisional. On the inner side we had some metal. Okay, and this is the surgery, day of the surgery, 1 day surgery, and of course immediate loading. That is very difficult to manage. Thinking about contact points, contact balancement, and the balance between left and right, anterior, posterior, and the management of this is full guided, of course, surgery, and the management of the vertical dimension. But it's not only related to aesthetics. I don't care about aesthetics in these cases. In these steps, of course, at the end of the process, I want a better gum, I want a better aesthetics, and I want to finish for my congresses. Why not? But this is the day of the surgery, and this is the Teethan during the day of the surgery, at the end of the day. Okay, It's not easy, but I maintain all the parameters I had before in my try-in and also a lower impact. Okay, this is because it was a long day and the patient is in absolutely it was not so good. And okay, but I started managing the provisionals with clinical checks, with managing, of course, the GAMS, and I had my X-rays to see if I had bone loss. Okay, 3D examination. 9 months after the surgery, and after managing for 9 months the provisional, 100% guided by Teethan, this is the aspect of my balance. Okay, it's not related to aesthetics because this is a bad provisional. I don't care at all. I want pretty amazing GAMS at this point. Okay, I don't care absolutely about aesthetics of the provisional at this time. Of course, later I started to, I will start. This is a case that I'm finishing nowadays. I will start to manage all the aesthetics, focusing on the shapes of the color, of course, of the teeth and so on. But look at the muscles, and these are the GAMS nowadays. This is absolutely one of the last photos I took. And okay, the point is that it's a very good weapon, the Teethan, to manage the occlusal point and the balance and the vertical dimension from 0 time to the finish, or like this case, to the time where we are ready to the final restorations. Okay, and this is the last case for today. It's a very difficult case. I started this case 100% with my Teethan. It's impossible to me nowadays to manage a case like this without my Teethan. Absolutely impossible, because we had no vertical dimension. Okay, and we had a very difficult patient. She came. It's a woman. 72 years old woman with depression. It's not easy to manage from like a, can I say, from an emotional point of view. The daughter asked me to have everything in few appointments, okay, because she was not good. Okay, this was absolutely an amazing case, an amazing proof to me. Okay, I started with bite block registration. This was not a patient of mine. Okay, this was a patient of a colleague of mine, and she started in analogical word, and after this bite block registration, of course, Voxis, I started 100% in digital world, in my digital world. But in these cases, so you have to think about full edentulous. Okay, is it right to have only the as a parameter to manage only aesthetics and only the lip, the upper lip and lower lip, and the symmetry and the medial line, the bipupillar line, or we can have more? Absolutely, we can have more, and I want to have more, because I start this registration with the Teethan. Okay, and this is how I manage this imbalance. I started with absolutely an imbalance, and I rebalance the axis. Okay. After that, everything in a digital world, and this is the lab side, and we have the digital workshop of the missing teeth, of course. And we printed this digital workshop, and this is the try-in. Okay. And like I said before, this is the most important time for this kind of rehabs, because we can have a lot of tries. We can change everything. We can change the tooth dimensions and shapes and the length, like okay, in this case, and symmetry, and of course the contact points, but only if we have and we can manage the Teethan, because these are the values with my okay, it's bigger. These are the values with my try-in at starting, the pre and the post. Okay, just a few checks, a few bars, and everything looks amazing. Okay, from the muscles side, the muscles point of view. This is the Teethan. Okay, the muscles point of view. We undergo the Cbct on the upper and lower jaw, the project, everything again to the lab. We have to manage a lot of information, but in this digital area, everything is possible for our technician. Virtual extractions, the WhatsApp is like a guide for the final restoration. These are the virtual abutments. Okay, the virtual workshop of the final restoration. These are the structures. I prefer, of course, screw retained Toronto bridge, screw retained implant bridges. Okay, these are modeled at the same time, and the contact points were checked before on the try-in with the Teethan. This is amazing. Okay, of course we have to we want to prove that everything is right. Okay, this is a gypsum try-in, but the gypsum it's not related to analogical impression. Okay, these are the real models printed, and everything is ready for the surgery. It's very fast, my surgery. This is the smile of the patient after half an hour or maybe 45 minutes. Very, very, very fast, very easy. Okay, there's nothing difficult during this kind of surgeries. Full guided, everything was good, everything is okay, everything is ready before the surgery. Okay, the patient was very, very, very happy. But what about Teethan? This on the right side is the Teethan the day of the surgery. It's not perfect because the impact, it's not 100%, but you can imagine that it's absolutely a great change between no vertical dimension and a vertical dimension like this. It's absolutely mind-blowing. Okay, and this is after only 30 days, 1 month. Everything is perfect. The patient was good, everything was good, no pain at all. Okay, and this is my approach to. These were only a few examples of my approach in prosthodontics. I hope you enjoyed